Hello, welcome to NoCo TV. This rant is entitled Healthcare U.S. Style. I know that's the big thing right now in the U.S. is the healthcare reform. And I live in the lower mainland in British Columbia. Um, and I'm a stone throw away from Seattle. I go down to Seattle a lot. I got a lot of friends down in Seattle. And I used to live in Ontario, in Windsor, Ontario, and right across the border is literally Detroit, and I have family in Michigan. So I get the perspectives from the Americans, and I get the perspective that CNN is fucking reporting. And I'm going to speak to the Americans here from a Canadian point of view. Don't watch CNN. Don't watch any news or some sort of news anchor who thinks he knows what goes on in Canada, because they like to drop the socialist. It's a socialist healthcare. You want the government controlling your healthcare? Well, let me tell you something about a socialist healthcare. Us Canadians, we do. Our government controls our healthcare. Our doctors and our specialists and everyone are salaried, and they get paid a certain amount. Now, when you go into the doctors here in Canada, and it's not like the U.S. The U.S. doctors make more money the more tests they give you. The more tests they prescribe, they get money from prescription companies, pharmaceutical companies, sorry, and a whole bunch of different things. Um, and the prescription and the pharmaceutical companies and make money as the prescriptions they prescribe you. The more tests they do, the more money they get. So they don't really want to cure you. Well, maybe not right off the bat. They got to make a bit of a buck off of you, and that's your health care. Canada's health care, well, the doctor gets paid the same amount of money either way. So guess what? 9 times out of 10, the doctor wants to cure what is wrong with you. They get no money. They just cure you. So the test that they provide you is what they really want to narrow it down, and they make no money off of it. And when they give you a prescription, well, they still don't make any money off of it. They just want to cure you. So, as a Canadian point of view, this is what happens. You don't wait 12 hours in an ER. I'll tell you how it works. It's a color program: red, amber, green, just like the stoplights. If you're green, these are people who come in who have the cold or even the flu. Nothing extremely serious. Those you will wait 12 hours because guess what, people? When you have certain sicknesses like that, don't go to the ER. You go to a clinic. If it's semi serious, you get an amber color. Therefore, your wait will go down to at least 6 hours to 3 hours to even 2 hours. Red, of course, is serious. Red is usually you come in on an ambulance, and if you don't come in an ambulance, it's basically life threatening. And guess what? You get right in. First in line, number one, numero uno. It is so extremely rare someone dies in an ER in Canada that I actually have not can recall one of actually even happening. I'm sure there is, but I don't remember any. Also, nothing is refused. It is free. It's free. Any procedure. If I'm extremely sick and I got to do a surgery, tests, prescriptions, you name it, I don't pay a dime. Except for prescriptions, and I'll get to that in a second. Now, we do get taxed high, and this is what you guys have to realize, the Americans, if you want a new health care. You have to be taxed. Everyone has to be taxed. If you're the rich of the rich or the poorest of the poor, you have to be taxed. But guess what? The Canadians have figured out a way to tax people in a certain way. The less money you make, the less taxes are taken off your paycheck. The more money you make, the more taxes are taken off. And there's not really a set percentage. Just the more money you make is the more taxes they take off. It's pretty simple. So when I get about, I don't know, $50 taken off my check, now you're thinking that's a bit of money, 50 bucks could be a case of beer, could be a night out in the town. But guess what? If I get sick, my hospital bill could be anywhere from $50,000 to $100,000. So my $50 that was taken off my check just paid for $100,000 hospital bill. Come on now, people. It's not very hard. I'd rather pay that than have to get a bill of $100,000 and be bankrupt. So, as everyone listens to what they so-called people, the people who know Canada on CNN, you have it all wrong. A socialist healthcare is quite the nice thing, let me tell you. I'm enjoying it. I've been in the hospital a few times, and guess what? The hospital stay is about $1,500 a night, and that's nothing. That's just staying. It's more expensive than a five-star hotel. I don't pay a dime. I pay the small percentage that my government takes off of my checks. So everyone in the United States who is worried about this new reform, you know what? Support it. And Obama, just tell the people. If what you want to do is be like more like the Canadian healthcare, which is not the best healthcare in the world, but it's damn well in the top 10, you just gotta tell people. I gotta tax it. You want it? It's gotta be taxed. It's not free money. Money doesn't come from trees, people. So from a Canadian point of view, this is when I get Canadian point of view, the healthcare is phenomenal here. But two, prescriptions. That's where they get us. We don't get prescriptions for free. But usually when you work for a company, you get it somewhat covered. I have private insurance for my prescription. So I get about 90% covered. So I still pay the 10%. So it's basically like $10 or $5 or $3 depending on the amount of money of the prescription. That is it. But as for healthcare point of view, when I got to see a doctor, I don't pay a dime. If I have to go to the hospital, I don't pay a dime. I break my leg, I don't pay a dime. The, you basically get the idea. So, if you need any more questions on healthcare when it comes to the Canadian point of view, don't hesitate to send me a message. So, anyways, what it comes down to the Americans, either you want it or you don't. But if you don't, remember this: you have the worst healthcare system in the world besides third world countries. That's pretty sad. Cuba has a better healthcare system than you. So that's something to remember. Because you know what? There are a lot of you people living the now. You've never been sick. You never had anyone in your family sick. But until you do, you'll know what it's like. Because I have friends who have, and they're bankrupt from it. So until it happens to you, you'll be fine. But guess what? You're not Superman or Superwoman. You are going to get sick one day, and someone in your family is going to get sick one day or hurt one day, and you're going to exactly know how the American healthcare works. So until then, I would support this reform, or don't come crying to me when you're bankrupt. This is No Code on No Code TV. Thank you, and feel free to comment.